Okay, so we have some other additional imaging tools. Mammography is sort of like your baseline test that everyone should be getting, assuming that you're at least over 30 years old. We don't do mammography in women under 30 because we're too nervous about radiation to the young breast. And so I'd say, once you get over 30, your breast is no longer considered young, but maybe you've noticed that yourself. So, there are other additional imaging tools. There's MRI, and this is wonderful because it has the highest detection rate of breast cancer of anything to this point in time. It detects cancer with a sensitivity of at least 98%. So the downside is it's very high cost. It's not available in rural areas. It has higher false positives, so you see a lot of things that look abnormal. So here's an example. This is an MRI, and all the little white things in here, you might think, well, gee, are all those cancer? Well, we think not, but cancer in hand-system looks like this also. So we end up doing a lot of biopsies on MRI for what we call false positives, things that look like cancer but aren't cancer. About 15% of patients cannot do MRI because they are claustrophobic, they hate the machine, they don't like getting an injection, they just don't like it and they just don't want to do it. Right now, because of the expense, MRI is limited only to women that are of very high risk, chiefly family history risk, or like you might have heard on the news this week about Angelina Jolie, a patient who has the BRCA1 gene. All those patients get breast MRI. And then the second technology that is commonly used is breast ultrasound. And yes, it can detect additional breast cancers. But again, the downside is ultrasound has even more false positives than mammography does. So you have extra or excessive biopsies done if you also get ultrasound that is a screening type of ultrasound. I'm not talking about the ultrasound where they're looking at a lump, but if you get a screening ultrasound to just look at everything, some little thing is going to be found and put on for a biopsy. Now, people have been working for at least the last 10 years to build a better screening mousetrap, something that's like a grenade that's really going to blow away the mouse breast cancer out of the sky, and at a reasonable price. So this is not an easy thing. The latest technology that has just became FDA approved last year is something called digital breast tomosynthesis. DBT is what it's called. And I'll show you how that's similar but different from a mammogram. They're contrast-enhanced mammography, just coming out of research right now, and what that means is you get a mammogram, but while you're having the mammogram, they're injecting you with iodine dye, like for a CAT scan. So you get an injection and a mammogram. There's also molecular imaging, which is radioactive particles that they inject you with and then take pictures. This is what we call like a nuclear medicine study, if you've ever heard of bone scans. It's something like that. There are also PET scans, which is a very high-tech, complicated technology that is quite expensive, and right now is really only used in staging of breast cancer and not used in screening. And there is automated whole breast bilateral ultrasound that has been FDA approved. So let's go back to digital breast tomosynthesis and talk about that first. We've been doing that at the University of Michigan for the last 7 years doing research with it, and this is the unit that we have here. And this is a different manufacturer, Hologic, which just got last year, 2011, got their Hologic unit approved. And no, it does not come with music, but the interesting thing about it is that the X-ray tube moves over the breast. See how that's different from your regular mammogram? And it's the motion of the tube that makes this technology different. And what did that does is it makes slices. And we know that there's nothing better than sliced breast, right? So it's kind of like that for mammography. We've been doing CAT scans in slices of the abdomen and chest and pelvis and head for the last 25 years, almost 30 years, and finally slices are coming to mammography. And why it took so long is because it has taken 10 to 15 years to get the radiation dose low enough that it would not be a radiation issue. So now the radiation dose is very, very low and similar to mammography, so everything's good. So as I showed you, the X-ray tube moves over the breast like this in the digital breast tomosynthesis. These machines are out there now and being installed in a lot of places. So this is no doubt coming soon to most of you. And it makes slices of the breast with the same radiation dose as one single view, which is a little bit magical when you think about it. So here's one of the very first cases that we did at Michigan several years ago when we were researching this. This is a regular mammogram. It's a woman who has a palpable lump. That's the little BB on her lump in here. And you'll see on this old film mammogram, you can see density, but you can't exactly see the lumps. Then we do the tomosynthesis image that makes the slices, and you'll see multiple little balls in there. Did you see those? She has multiple cysts. Let me go back. Oops. All right, we'll do that one more time. See all the individual slices that make the individual balls. So that looked pretty amazing to us when we first saw it. We were pretty happy. Here's a single slice showing you the same thing. The mammogram, you just see density. On the DBT, you see individual masses. And this is another case. In this complicated looking mammogram, a lot of black and white in here. Where is the cancer? Well, I'm going to show you where it is. It's real easy on the slice of the DBT. This is one of the slices, and here is the cancer. You can, lots of times the cancers on a mammogram have these little spidery legs that come out somewhat like this. So this is a real obvious cancer on a DBT. It shows you how much better we could see the cancers on the DBT. Another example of film mammogram, this is what's called a spot view. That's when they call you back for an additional picture, and they do this one little part of your breast and smash it and look at it really closely. This is the spot view on a regular mammogram, and this is just one of the slices of the DBT. And again, it's really well seen, this cancer. See the little spiculated, legs, almost like a spider coming out of it. So it's obviously a cancer on this image, not so obvious on the old image. And this was a case just done a few months ago here. This is a beautiful digital screening mammogram. You know, you get two views of one breast. Here's what's called the craniocaudal view, and this is the mediolateral oblique view. And it really looks normal. It's a moderately dense breast, so we know we could miss something, but I can't see what it is we're missing until we did the digital breast tomosynthesis. Here are some of the slices. Look in this area, and you'll see something funny right there. Let's look at that again. So that looks suspicious, and here's one of the slices, and again you can see this irregular density in here. And I'll show it to you as compared to the screening digital mammogram. So again, remember, this is the best we can do right now before this new technology came forward. This is the tomosynthesis. And by the way, I think I forgot to say at the very beginning of my talk, I have no disclosures to make. I'm not paid by any company to talk about anything. So I'm not trying to make an advertisement. And in fact, I'll show you that tomosynthesis is also not perfect, but it does seem to be an improvement over what we have. And in fact, although Hologic is selling their machines out there with We don't have any plans right now to buy one yet. So, as I said, this company called Hologic got FDA approved with their DBT, and at first they were doing 2 mammograms of each breast, and also their tomosynthesis images, which that's about 100 pictures of each breast now when you get the DBT. So a lot more pictures, which is harder for the radiologist, but it's no more difficult for the patient. It's still just one picture for the patient, and it makes all these slices, and at the same radiation dose. So the latest research studies on this seem to show that detection is improved about 10 to 25%. So yes, we are finding more cancers. And the false positives are also going down just a little bit when they added this tomosynthesis to digital mammography. It was twice the radiation dose, but now FDA has just approved Hologic to not do the digital mammos anymore. They can just do the DBT and be done with it, so that'll be just the normal radiation dose. Okay, so now the bad news is still not all cancers are visible as DBT. It's not the be-all and end-all. And this case shows that this is a woman with a palpable lump. Remember I said palpation hasn't gone away yet. And here is the marker that demonstrates where her palpable lump is. And sure, maybe it looks a little bit more dense in here. It's a little bit whiter, but I can't say that I see a cancer for sure. And here's the tomosynthesis. It's a complicated picture, that's for sure, but I can't say that there's a cancer there. It's very difficult to interpret. It's like the Lego table again. But we do the ultrasound, and any of you could say, yes, I see a mass. That's pretty obvious. There's the mass. There's her cancer. Easy to see on that ultrasound, but hard to see on the mammogram. So in summary, with this new technology called DBT, it does, in the preliminary studies, it looks like it will improve detection. It will help us characterize lesions without additional mammography. That means fewer people will have to be called back for additional imaging, which means it reduces those false positives. Now, as I showed you, the false negatives still exist. DBT can definitely miss cancer. There are still large clinical trials in progress, so we're going to know more about it in the future than we do right now.